All right. Good afternoon, everyone. This is Shivneel here. I'll be presenting on cancer awareness today afternoon, specifically on breast, cervical, and prostate cancer. As we know, October and November is October is breast cancer awareness month, and November is prostate cancer awareness month. But in general, I mean, all cancers are hazardous to anyone who ever gets it. Before I begin presentation proper, I would actually like to say a big thank you to Fiji Cancer Society for actually providing the data for the presentation, and also to my intern Ms. Varsha Narayan for actually helping out in the presentation. And she did quite a bit of work for this. And so we'll just continue with the presentation. As we go ahead, we'll discuss the individual cancers separately, and we'll also go on the symptoms, the screening methods, and what can be done also. Before we start also proper, I would like to say that cancer is not a disease that affects just the individual person. Unfortunately, it is one of those things that affects the whole family, anyone around you, or if you might know anyone who has had cancer, unfortunately, you would know that the whole family gets affected by it. It's not just the individual person. It's a very draining disease, uh, and I believe as a pharmacist, I believe it's a very crucial role that we play as educators, rather than just drug dispensers, in also creating awareness. And I think believe we can do our part. And I would like to actually thank Fiji Pharmaceutical Society for actually giving me the opportunity to actually be part and create some sort of awareness for this month, and hopefully we can continue creating some sort of awareness, not just for this particular 2 months, but probably continuously develop something. All right, so I'm just going to be talking about the most common cancers, particularly in Fiji. We have over here, so we have breast cancer. I think it's one of our leading cancers in Fiji at the moment. uh, the common myth with breast cancer is that it affects only females, but that is not true. It affects both male and female, as we both have breasts. It's probably different. Then we have cervical cancer. Uh, this only affects females, well, for anatomical reasons, obviously, because females only have cervix, not the males. And then we have prostate cancer, which just affects males. Right. So once you go through the presentation, you actually see there's a slide from Dr. William May, who's a dean at FNU College of Medicine and Health Sciences. So he just states the common type of cancers, the cancers that they came across in CWM in 2019. So leading the numbers, we actually have breast cancer, which is currently at 139 cases, which is quite a large number if you look at it for such a small population in our country. Then after that, we have cervical cancer, which is at 90 cases. Again, cervical cancer is pretty preventable in Fiji, since currently we have the vaccine which is being administered at quite a large rate, and covering quite a large number of the population. And then you have your other cancers. You have ovary, you have your endometrium cancer, then you have your prostate cancer, which is at quite a high number too, and then you have your bladder, kidney, and testis cancer. And then you also have about 5 cases of brain cancer, and then you have your colon and rectum cancer, and the upper GI tract. All right. So for breast cancer, we're going to start on that. Please remember, again, I'm just repeating this, it affects both male and female. It's just not females, so we really need to get the myth out of the way. Risk factor for breast cancer. So I'm just going to discuss a few. I'm not discussing all. Advancing age. So with breast cancer, one of the things is the older you get, there's the higher chances of actually getting breast cancer. Smoking. It just does not lead to lung cancer. In most cases, it can also lead to breast cancer and other sort of cancers also. So if you know someone who's smoking, or if you are a smoker, it's advisable and strongly encouraged that you stop smoking actually. Alcohol and obesity. Drinking lots of alcohol, obviously that will have a lot of negative effects on your body, and obesity too, it does affect. There have been certain research which they say it does affect your hormonal balance and all those things, and which can lead to breast cancer, but research is still currently undergoing actually. And the last factor, and probably the most obvious one, is actually having breasts. So if you do have a breast, you'll obviously you have a chance of getting breast cancer. So what are the main things we can do in regards to breast cancer? Well, Most important one, and I would say the easiest one that we can do currently, is self-examination. Simple process, you can do it at home, you can do it by yourself. You just need to be aware now on the procedure and actually on how to go about doing self-examination. You can attend clinics. I know for a fact that Fiji Cancer Society has an open door policy. So if you think you are having lumps, or if you're seeing that you are not feeling well, if you notice something out of different, you can just walk into the office. You can ask to see someone. They will arrange people for you to go and see the clinicians or whoever. They have their own site nurses too, so you can get an examination done by them also. Or the other option is you can just visit your nearest health center or doctor, depending. If you want to go to a private GP, that's fine too. If you want to go to the public sector, that's fine also. But the most important thing is that you self-exam. If you find anything, get it treated or get it checked as soon as possible. The sooner the better. Some of the signs and symptoms. Lump is usually on one side of the breast, but it can be on both sides too, depending. If you notice any, so lumps would be the most common sign that you would see, and something that you can easily feel. Changes in shape and size of the breast. So if you notice any irregularities, any changes in the shape, size, nipple discharge. I mean, if nipple discharge happens, I think this should be one of the major warning signs for people actually, to actually go and get it checked, because that is going to be very highly unusual thing to happen. A pulled in nipple, right, and basically changes in the skin color of your breast. So if you notice any rashes developing, any redness, any swelling, lump, some nodes developing, that is something that you do definitely want to get checked up. So again, just focusing on the signs and symptoms. So we basically have a chart here which actually gives a visualization of the signs and symptoms. So again, I said that would be the lump, the pulled in nipple. You'll have dimpling, dripping of the breast too, or actually the nipple in particular, redness and rashes, and skin changes. So if you notice any discoloration, again any skin color changes, those are the signs that you should be looking out for. Again, applies to both male and female. So self-examination. So this is one of the easiest and most simplest method that you can use, and I would say it's one of the most easiest screening methods possible, because it's something you can actually do at home and on a weekly basis or something on a monthly basis whatsoever. So the first step would be to raise your arms, right, and then lower your arms and just pressly firm them against your hips. Look to the side, like so you go from side to side just to see if there's any changes in the shape of the breast, nipples, or appearance of the skin. You look out for all those signs. After that is done, then you actually, in a circular movement, feel from the armpit, feel your armpits for lumps. So you have to actually go in a circular movement, pressing firmly also. So start from the outside and then you move inwards. The same thing happens with the breast. You start from the outside and then you feel inwards, going around the breast and behind the nipple, underneath the breast, around it too, just to see if you can feel any lumps. And then finally gently squeeze the nipple to check for any bleeding or discharge. So squeezing the nipple just to see if you can get any bleeding or discharge. If that's one of the signs that you do get, if you find anything, again please go to your nearest health professional, doctor, nurse or GP, or whichever you prefer. And the last step is just to lie down and repeat steps 4 and 5 again, just to see that we're not missing out on any portion. It's just an extra precautionary step that you need to take. Again, very important. I think this is something we can just print out and just keep in our pharmacies, to create awareness for our patients and customers. I'm pretty sure there'll be people who'll be interested in it. So one of the things is the breast cancer treatment also depends on what stage the cancer is found at. So you usually have 4 stages. So I'll be just speaking on the different stages. So stage 1 would be the lump size is less than 2 centimeters. So what the treatment is, basically you just remove the lump. So it's pretty straightforward process. If you find a lump, they do a biopsy. If they find that it's cancerous, less than 2 centimeters, stage 1, the only thing they do is just remove the lump. Chances of survival is 97 to 100%, which is in 5 years, which is quite a good survival rate actually, comparatively speaking. And then the stage 2, if the lump is more than 2 centimeters but less than 5 centimeters, and it may include some nodular involvement. Okay. And so the treatment would be wide local excision or hormonal therapy, which mainly involves tamoxifen, and survival chances are 88 to 93% in 5 years. Okay, and continuing, so now we have stage 3. So this is where the lump is more than 5 centimeter in size and lymph and node involvement is also present. So this is a new adjuvant therapy where you have chemotherapy and mastectomy, and it could also be with chemotherapy later on or not chemotherapy, depending actually on the outcome of the surgery itself. The chances of survival like 72% in 5 years. Stage 4 is basically when this is actually spread to the bones and the lungs. This is actually the final stage. Normally, it involves palliative chemotherapy and palliative mastectomy. Chances of survival, unfortunately, with this is very, very low. It's 5 to 15% in 2 years. All right, continuing on with the next slide. Ways to reduce your breast cancer risk. Don't smoke, control your weight. Again, obesity is one of the risk factors. Limit or avoid alcohol. So everything in moderation is good. Too much of anything can be a bad thing also. Breastfeeding also helps to reduce breast cancer, and being physically active, and also avoiding exposure to radiation. So basically any high energy sources would be highly advisable to avoid. Also, one more thing I'd like to say, unfortunately in Fiji we do have this trend where people tend to go to our traditional healers first rather than seeing a medical professional. I believe as pharmacists it's our job and our role to actually educate our patients or our customers in finding the right people at the right time. If they do find something out of the blue, if we can get them to the right people at the right time, we could be potentially saving a life. So rather than sending to all these herbal people who make this herbal medicine or these traditional healers or the witch doctors in Fiji who are very famous, probably just getting to the medical professional on time will definitely save a life. Alright, now we'll move on to cervical cancer. So this is just a cancer that basically occurs in the cervix, normally the lower part of the uterus that connects to the vagina. So one of the agents that we know is the HPV virus, the human papilloma virus. Basically lives on the skin of the genitals. So one of the risk factors is actually, the transmission mode is actually sexually transmitted either via the vagina, mouth, or anus. So actually being sexually active increases your chances of actually getting cervical cancer. So one of the good things is if you are sexually active, it's highly advisable to actually get a pap smear done too, just in case. You can never be too sure. So risk factors: having a large number of sexual partners. Anyone can have the HPV virus and they can spread it to you with or without knowing about it. Having a weak immune system. Smoking, again smoking will be coming up repeatedly. Infections with other STIs, especially syphilis, gonorrhea, and warts. This also increases your chances of actually getting cervical cancer. One of the signs and symptoms that we are supposed to be looking out for in regards to cervical cancer would be unexplained lower abdominal and back pain. So if you're continuously having abdominal and lower back pain, and even after you go to your doctors and everything, and you can't actually get any source of information of what's causing it, it would be advisable to actually get a pap smear done and to see if that could be potentially one of the causes. Also, you'll notice pain during sexual intercourse. That's also something that you need to keep a lookout for. There could be multiple reasons why that is happening, but could be a possibility. So it's definitely something you'd want to get checked out. Post-coital bleeding. That's also something that needs to be looked at. Increased vaginal discharge. So if you notice that there's more than the usual amount of vaginal discharge, is something that really needs to be looked at. Menopausal bleeding. So if you're in menopause and then you actually have bleeding, definitely a warning sign. And menstrual bleeding that is longer and heavier than usual. So if you're having more common, your bleeding, menstrual bleeding is more longer, more heavy, more frequent than what it is usually, it could possibly be a sign for cervical cancer. So that's something that also needs to be checked up by a gynae or a GP. So in the next slide, you will just basically have a comparison of a healthy looking cervix and a cervix that actually has cervical cancer. So the first one is that's a healthy looking cervix. So as you can see, it's normal, pink, skin's intact, there's no swelling, no inflammation, nothing whatsoever, right? This is a cervix with cervical cancer. So as you can see, there's a very, very big difference. You can see a lot of inflammation, you can see nodes, you can see a bit of pus there too, and just the enlargement, as you can see. So just to get a better comparison in comparison to a healthy looking cervix. So prevention, we are very fortunate in Fiji that we do have the HPV vaccine available. So it's definitely highly encourageable to get our kids and yourself vaccinated against HPV. I think this is one of the only cancers which actually has a vaccine available, and we're very fortunate to actually have this available in Fiji, and also being actively promoted to have the HPV vaccine done. Pap smear, this is one of the best and most easy screening methods. Also getting screened, so if you notice anything unusual or if there's a screening taking place at workplaces now, the good thing about breast cancer awareness October and November is that we have a lot of screening taking place via Fiji Cancer Society and other organizations. So it's always good if you have the opportunity to get screened, or if you have the time, do definitely get yourself screened. It doesn't hurt, and it's always good to be safe than sorry. Prostate cancer. So this is a cancer that only occurs in men. If I personally in my pharmacy have had a couple of customers who actually do have prostate cancer, and I can tell from just looking at them firsthand that it is a very debilitating condition. The inability to walk, actually have a long life, the constant pain, all these things just really affects the quality of life. So this is going to continue on prostate cancer. So prostate cancer is the most common type of cancer that occurs in men. It's particularly common in Fiji too. It happens when the abnormal cells in the prostate develop and multiply in a controlled way. It just spreads, outside the prostate to distant parts of the body. So the risk factors for actually getting prostate cancer, it is an age-dependent disease. Means the older you get, the higher the chances of actually getting prostate cancer. So I believe if you're 35 and above, it's time you get yourself checked. And if there's a family history, this is also a risk factor. So if a first-degree male relative has prostate cancer, you should definitely get yourself checked out. Diet is also involved. There is some evidence out there that eating a lot of processed meat, which is basically what we eat now every day, can increase the risk of developing prostate cancer or any form of cancer actually in that case. And lifestyle, the environment and lifestyle also is a factor for all three types of cancers. Depending on what you're exposed to, can also be the agents can be carcinogenic, you would not know, so that can also actually lead to developing cancer. So just going to explain on some of the symptoms. In the early stages, there may be no symptoms, which can be difficult, especially when you're trying to diagnose someone with prostate cancer. But some of the symptoms that you'd see is that there is a frequent feeling to urinate, but there will be a difficulty in urinating also. You want to urinate, but you're not able to. The other thing would be discomfort when urinating. So it's like a big struggle, or it's a very uncomfortable process to actually go to urinate. Finding blood in the urine or the semen, either or, should definitely be checked out. I mean, blood in any of our bodily fluids should definitely be a factor that needs to get checked out. And also, I think one of the most common symptoms that would be pain in the lower back, upper thighs, and the hips. So basically anything around the thigh and hip area and lower back. If you're getting unexplained pain for quite some time, and you've got yourself checked out and everything, it would be a good way to get your prostate checked out just to see in case. So to all my male friends, definitely get it checked out, especially if you know you're increasing, getting older by the day. So diagnosis and how do we go about actually testing for prostate cancer? Unfortunately, for prostate cancer, it's a very invasive procedure to get it checked up, but we also have other methods too. So there are two ways. There's a physical examination and then there's a blood test which is performed. So the blood test is called the prostate specific antigen, or PSA. So the test result basically shows whether there is an increase in the specific protein, which is a PSA, but it does not necessarily mean that you actually have prostate cancer. And then the other method is, and the more invasive and very uncomfortable method, which would be the digital rectal examination. This is basically where the doctor inserts a gloved, lubricated finger into the rectum and basically twists the finger around just to see the size of the prostate and to assess if there are any abnormalities. Probably one of the major factors as to why prostate cancer screening is at a very low rate in Fiji due to the invasive procedure involved, because we don't want anyone sticking any fingers up our posterior, obviously, but and also biopsy. So this is just like a very definitive confirmation if you have prostate cancer or any form of cancer or not. And then this is just a picture to show where the prostate is, and then it just shows the cancerous tumor. So you can just have refer to the diagram. So also with treatment, it's not mentioned in the slides at the moment, but in Fiji we are fortunate enough to actually have chemotherapy going on in 3 of our major hospitals. I think, as far as I remember, we do have 3 3 oncology departments. So one in CWM, one in Lotoka and Lambasa. So we do have treatment for certain cancers which is available, and we also do have one oncologist in Fiji, which is Dr. Ane. But unfortunately in Fiji, due to the lack of expertise and lack of equipment and other resources, we are not able to treat all types of cancers. That doesn't mean that we should not try to prevent it in the early stages as soon as possible. So conclusion, all cancers, they can be treated if it's detected early. The longer you wait, the lower the chances are for a successful outcome for treatment. Don't wait for any signs or symptoms. Just get yourself screened. There's no harm in getting screened. It doesn't hurt. It's free in Fiji. Thankfully, we don't actually have to pay for any screening or anything whatsoever. You can visit your nearest health facility, or you can actually visit your own pharmacy. Pretty sure we have a lot of qualified pharmacists who can give a lot of information about any sort of cancer or any treatment modalities that are involved. Obviously, we are not experts, but we can direct them to the people that who need to get further information, and getting ourselves screened. So screening is the most important portion actually of this whole scenario. And that would be the conclusion for this. There'll also be question and answers that would be following, so it'll probably be at least another half an hour of your time to just get the question answer portion sorted. And if there's any questions, please feel free to contact the society, and I'll be more than happy to answer any questions that will be coming my way. Thank you for listening.
Okay, thank you, Mr. Shivneel Singh. If you don't know, Mr. Shivneel Singh works at Life Farms in Makasi. He's also was one of our presenters at our 2019 annual conference. So thank you, Mr. Shivneel. Let me just we can start a little bit of discussion on this topic. It'll be good for like people to refer to and people to hear and perhaps formulate their own thoughts. My first question, what do you think is the role of pharmacy in terms of cancer awareness?
Okay, I believe as pharmacists, I don't think we primarily have the role of just drug dispensers. I'm a firm believer that we are against that. I believe our first and foremost role is actually educators.
Yeah.
We educate people how to take the drugs, what to do, what not to do, other health related information. So in terms of cancer specifically, I think it's very, very important that we empower ourselves. Firstly, what are the signs and symptoms, all right, of the cancers mentioned, and not just the cancers mentioned, but if you do notice anything unusual, uh, obviously, and where do we refer the people to? You can't just have the knowledge and not actually guide them to the right places.
Mm.
It's a very scary, very emotional disease. All right, it can be something that overpowers your thoughts and your logic. So obviously, you're gonna seek family support and whatever, and normally you get wrong advice. That's why our traditional healers and our uh, what can I say, our witch doctors, sorry,
Yeah, that's
are very popular in Fiji
yes, yes.
because they're easily accessible
Mhm.
and people unfortunately readily know about them.
Mm.
Now, as in terms of pharmacist, in terms of pharmacy, I think what we can do, we can refer them to the right people. So that would be the health centers. Fiji Cancer Society, like I said, they have an open door policy. If you feel there's something wrong, if you feel like you're not right, you can go up to them. They'll definitely guide you. They do have the in-house nurses. Unfortunately, don't have an in-house doctor at the moment, but they can guide you to the right person, which would be Dr. Ane eventually. And also, we can create awareness. So having information charts in your pharmacy, uh, contact numbers, keeping the contact numbers, Fiji Cancer Society, Empower Fiji, um, MSP also does screening. They also do pap smears and also things like that. So you can also direct them to those people over there too. So there are a lot of NGOs that are actually involved in this. So it's just about, I would say, awareness, 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 and more awareness. The more we push out the information, the more people are aware, the more proactive approach they can take.
Yeah. So, do you feel like I feel like that now at this stage, there is not one family that's not been touched by cancer. I feel like it's becoming more and more prevalent. Do you think that's true? Or?
I would definitely agree with that. I would say personally, I have been. It happened with my mom. Unfortunately, she had a giant cell tumor, and if you look around anywhere, I'm seeing this more and more cases of people actually having this. I pretty sure that everyone who's listening to this will also know of someone who actually has some sort of relation to cancer, either directly or indirectly, or one of our patients or our customers, who we see all on a regular basis, who might be suffering from some form of cancer, unfortunately. So yeah, it is getting more and more prevalent, but I am not saying that the numbers are increasing. I think the awareness being created and people getting checked.
Yeah.
So we are actually having more data coming in.
Yeah, that's also a factor. Like that's the two sides of the scale. Like, are we actually getting more cancer cases, or is our screening and our detection methods increasing so that we can detect more cancers? Like, is that like a consideration?
Yeah, I would say I think we're detecting more cases. I think the screenings are being effective right now with the awareness that is going on, and I think a really wonderful job is being done by all the organizations that are involved in creating awareness, because it's everywhere right now. It's on social media, it's on all the workplaces. If you look at the radio advertisements to TV, posters, it's in your face right now. But that's what we need. We need that to happen. And I think that would lead to one of the contributing factors to having more cases. But I don't think it's actually having more cases. I think we're just detecting more cases
Yeah,
right
I think
now.
it's like the approach with coronavirus. The countries that do more testing get more cases.
More
but,
cases.
But that's not really necessarily a bad thing, because the countries that don't do testing, although they show low numbers, doesn't mean they have low numbers.
They have low numbers, exactly.
Right. So same thing with cancer. The more you're able to detect, the more cases you'll have. But again, that does not mean that the cases weren't there to begin with. Yeah.
And having the data there allows you to develop health policies specifically to this particular condition. It allows us to divert our monetary resources towards that. What equipment do we need? What medicine do we need? Who are the people that we need? Do we need to create a separate treatment space for these people? What awareness can we do? More data allows us for more logical decisions to be made and allows us to use our limited resources more wisely, I would say. So
yeah, that's true. Okay, so next up, I want to talk about breast cancer and how we're seeing that people of younger age groups are getting this.
Yeah.
And I believe familial history is a very strong causative link. What do you think about this?
I do definitely agree. I don't think any cancer discriminates regardless of age, gender, or whatever. obviously depending on anatomical reasons, it can just be specific to one gender,
Mhm.
but it does not discriminate. So you can be either really young or really old, or just starting in your early teens or late 20s or whatever it is. It does not discriminate. It can happen to anyone, and like you said, a strong familial link. Yes, there have been a number of recorded cases where if one person of the family has it, there is a higher chance of another person having it,
Yeah.
and it is definitely a strong familial link. And also, as you mentioned, I think you mentioned someone very young
Yeah,
was detected.
I know a particular person who's
Yeah.
like in the early 20s who's
Yeah.
been screened and diagnosed with breast cancer. So, yeah, it's kind of alarming,
Exactly.
like how does this happen? And
Mm.
yeah,
I think we react too late to it, as unfortunately when we know someone who has it, then we start finding out.
yeah,
Uh,
yeah. So, yes, early detection is like key. Yeah,
The key.
Yeah,
It's a key.
Yeah, literally. We all need to, as pharmacists, steer people towards early detection and going for screenings, getting health checkups on a regular basis.
Yes, definitely.
And yeah,
And the best thing about this in Fiji is it's free and readily available.
yeah, it's very fortunate enough to have
We have
free healthcare, unlike some other countries in the world. Some other very developed countries in the world that do not have free healthcare,
exactly.
and where you have to pay thousands and thousands of dollars to get just a test done.
Yes,
And over here, it's all free.
it's all
You
free.
just go to your nearest health center and get screened.
Mhm.
And yes, you said like the government always runs screening programs on awareness campaigns. Do you think we're doing enough, or do you think we should be doing
I think we can do more. There's obviously always room for improvement.
more?
You will always miss out on something,
Yeah.
but collecting data, making logical decisions, we can improve. There's always room for improvement. I think there might be a misconception that since October, November, like the highly highlighted months for breast cancer and prostate cancer, that people think that screening happens only at that time. No, it's
No,
all year
it's
round.
continuous.
Yeah, it's a continuous thing. You can go in any time.
Yeah.
So I think we need to just create more awareness. No, you can go in any time. You can get it done.
And you talk about data collection and all this. This is very a scientific way of doing things. The scientific
Yes.
method, basically collecting data
Yes.
and making projections so that we can better understand the disease, so we can better prepare for it, and we can come up with better treatments. And you said you're discouraging people from going to just relying on traditional healers because it's culture in Fiji. Yeah, just you go run towards these people who do not have any qualifications and who actually end up doing more harm than good.
Exactly.
Yeah.
If I remember, this was a couple of years back, and I think Dr. Wanga presented, our current health minister. He said, unfortunately, for many cases in Fiji, people run to the traditional healers first, who actually make it worse, and people presented to me at the very last stage where they can't really do much.
Yeah.
So, in case of cancer, the earlier the better. The earlier you detect it, the higher chances of survival.
And most cancers have this insidious habit of hiding.
Yes.
Like the body will hide the cancer. The body will not let you know that it's sick until it's too late.
Right.
And it's normally when you start getting the symptoms that it's towards stage 3 or stage 4, in which case you can't do much about it.
Exactly.
Yeah, especially in Fiji, we have limited medical resources to be treating these diseases.
Exactly.
Yeah. So early detection.
Early detection is the
Yeah.
best method.
Okay. You also talk about a radical treatment for breast cancer, which is mastectomy. You can elaborate more on this?
So basically, mastectomy refers to this removal of the breast. Now, I do know there's a very huge social stigma attached to this in Fiji, and it is one of the factors that actually prevents people from actually going out and seeking treatment. I can't speak behalf of the ladies because I would say that you would feel incomplete. I mean, if it happens to me personally, I would feel incomplete, and I think the social stigma attached to it prevents people from actually seeking out treatment. But it's better to have that done rather than losing your life and just having a whole lot of sadness that follows it later onwards.
I guess it speaks to identity as females, like having breasts. It's a big part of your identity and your gender. And I guess people feel violated in a sort of way when they have to undergo this procedure. But it's life saving.
It is.
Yeah.
It's not necessarily that it will happen. It depends on the stage of
Yeah.
cancer too.
And also, I guess in Fiji we're lacking a lot of expertise in plastic surgery, so we can undergo breast reconstruction, implants, so to help people who have undergone mastectomy to lead a more normal life. So I don't know if that's done in Fiji or
It is not.
no. Yeah,
It
so
is
you have to
not.
go overseas for this,
Yes,
and
yeah.
it's very expensive.
It's very
So
expensive.
I think that's another factor in people seeking treatment.
Yes.
Yeah.
It's just a treatment factor, but also I think we really need to change the mindset of people too.
Yeah.
It's hard, but I think it's something that really needs to be done.
Yeah.
Acceptance,
Hmm.
you know.
And
It
yeah,
has
I guess also talking about it.
Yes.
It's not like opening dialogue.
Yeah.
The more you talk about it, the more normal it becomes, and
Yes.
the more people open up, right?
Exactly.
Okay. Also, for cervical cancer,
Mhm.
you said there is a vaccine against the human papillomavirus. So this is a vaccine against one particular risk factor for
Yes.
cervical cancer, but
Right.
it does not mean you're immune to getting cervical cancer.
Yes.
You are immune to perhaps one particular risk factor,
Yes.
but all the other risk factors are still there.
Still there.
Yeah.
Yes, that is correct. That is correct. I think doesn't mean that you got the HPV vaccine that you won't get cervical cancer. No, that's not the case. But it does dramatically reduce the chances of getting cervical cancer. But obviously there are other risk factors involved. Again, being sexually active, having some sort of STI can also increase the chances of getting it. Lifestyle, alcohol, obesity, all these things are involved also, and smoking.
Okay,
So smoking, I would say, it's just a big no-no
yeah, it's literally a risk factor for every sort
for
of
every
cancer.
sort of cancer. Yes.
Yeah, it's just it's nasty and it's
Yeah. But I think what we have in Fiji over here, I think every in the budget, the prices for cigarettes keeps on going up,
that's good.
which is good. Unfortunately, I do hope it reduces people from smoking, and
Yeah.
it discourages them from
Yeah.
smoking.
Well, when you talk about smoking, it's the most addictive drug, nicotine.
Yes.
It's more addictive than cocaine or any of the hard drugs,
Mhm.
and it's openly sold on the streets. And it's a contributing factor to so many
Agreed.
cancers. So, what do you think? Like maybe, I mean, if you go the harsh route, just ban the whole thing altogether.
I won't be able to comment on that. Unfortunately, I'm not the one involved in the decision making.
Well,
But it does have a lot of other factors that you have to take into
yeah,
account.
and as pharmacists, we have an active role to play in getting people to quit smoking.
Yes, we do.
Yeah.
Yes, we do.
So,
Definitely, I mean, your nicotine gums and all the other factors. The cold turkey method, emotional support, I would say. Leaving such a hard co-addictive drug is just very, very difficult.
okay, so the last question I had was on prostate cancer.
Mhm.
So again, men are the last sort of gender group, whatever, to seek treatment for any kind of disease.
Any kind of disease, yes, agreed.
And especially when it comes to like very personal health, they are the worst. I mean, like in seeking any sort of help and attention regarding this. So you can elaborate on this as well.
Well, I think the first thing that would come into mind, and probably people would laugh at this, I think the male ego comes in factor before anything else.
Yeah.
I think our ego comes into play, with that we refuse to seek help.
Yes.
And also, unfortunately, for prostate cancer screening, it's a very invasive testing.
Yeah. It doesn't help.
You wouldn't want anyone sticking a finger up your posterior, but
Yeah.
unfortunately, that's the digital rectal examination is the one of the ways that you can screen.
And it's one of the easier ways to get.
Easier ways to do it, and one of the more quicker confirmative ways of actually doing it,
Yeah.
because the PSA will be high, but it does not mean that you do have cancer. Enlargement can happen due to other factors too.
So we have benign prostate hyperplasia.
Hyperplasia too, yeah.
Which is also on the road to prostate cancer, but
Right.
not necessarily. Right?
And the good thing about BPA is in Fiji we do have the drugs which are readily available to treat it.
Yes.
Yeah. Unfortunately, not available in the public sector, but we do have it in the private sector. So, it is an invasive procedure, but then it's something that really needs to be done. And then you also have the radiological methods, where they do scannings and all those things. A colonoscopy can happen too, depending on what the doctor prescribes. But yes, we do have the drugs available readily for BPA, which can lead to I say, and I'm emphasizing can lead to. It's not a necessary that will lead to that prostate cancer. But yes, and unfortunately, in Fiji, I think we are falling behind on the prostate cancer awareness portion.
Yeah, also screening perhaps.
Yeah.
People don't regularly go for. I think it's
I
more,
don't think I have seen any screening clinics happening in Fiji for prostate cancer actively
Okay.
as much as we had it
Yeah.
for breast cancer and cervical cancer.
Yeah.
If you notice the no Movember or No Shave November does not get much attention as
Yeah.
our October awareness.
Do we have a ribbon color for that?
I don't think so.
We have pink toba.
There is something I think we really should find out about and probably assign a color and get a movement started.
Yeah.
You know?
Yeah, you can find out if there is one.
Yeah,
Actually,
I'm pretty sure there is.
yeah, but we don't really actually promote it. Yeah.
And see, that's where we are lacking.
Hmm.
And this is the whole point of the discussion, where we can actually increase our knowledge base and actually try to get people to be more aware where these are factors available. Let's try to do something about it. The more we get aware, the more we can actually start helping out people. And I believe with more awareness we can actually save more lives.
Yeah, and that's the end goal.
That's the end goal for us at the end of the day. Because like I said in the beginning, cancer is not a disease that only affects the individual. It takes the whole family down with you, your whole support structure. Also, it's not just a physical disease. It's not a physical manifestation. The emotional support is crucial. I'd like to point this out. Psychological factors do determine if you're gonna beat it or not.
Yeah.
We do, fortunately in Fiji, have free psychological counseling available. Fiji Cancer Society is probably recruiting, if I'm correct, or speaking to one of the execs. They might be getting in people. And we also have Empower Pacific, which also provides counseling services for people. So we can direct people. There's MSP also that has counseling services. They also do pap smears, family health planning, all those things. There are NGOs available that are doing all these things. Maybe we should start getting in touch with them.
Yeah.
Open up dialogue, like you said.
Yeah.
The more we talk about it, the more we can help out people.
So it's just a matter of utilizing the resources.
And
Yeah.
communicating.
Communication is.
Everyone has the same goal,
Yeah.
but we are not communicating properly at this particular stage. But I do hope in the future, we get to that point where, okay, someone walks in, they said this.
Yeah.
Okay, you can go here, you can go here, you can go here.
Yeah.
Done.
So the pharmacy can be a good hub for directing people to
Yes.
the resources.
Definitely.
Yeah.
Definitely. I believe we are a very good hub for directing the resources.
Yeah.
And I believe we have been doing that. But I think we just need to create more awareness on that particular basis.
Okay, well, thank you, Mr. Shivneel Singh, for this presentation. Thank you for listening, and I hope you enjoyed it. Thank you very much.